everyone, it's Susan and Laurel again. I'm sure you're all ready for spring just as much as we are. This has really been a whirlwind legislative year in the state of Kansas. So we want to take just a few minutes and review where we're at with the advanced practice bill. So Susan, can you remind us what happened with House Bill 2256 and Senate Bill 174, kind of just a summary of what the bill involves?
Absolutely. There's really 3 points to the versions of these bills. And first, we wanted to let you know that this bill removes outdated regulatory barriers that decrease access to healthcare from APRNs. Specifically, these bills remove what's known as a collaborative practice agreement, kind of a permission slip, and we call them CPAs. A component of the section of the bill is a requirement of a structured transition to practice for new graduates. They'll need to have 4,000 hours working with a physician or an APRN before they can go on their own license. And another part of this bill is APRNs will be required to carry malpractice insurance and participate in the Healthcare Stabilization Fund. And lastly, this bill aligns with current national standards for best practice of APRN regulation and practice, and all APRNs will be required to obtain and continue with the national certification. So really the removal of these restrictions in other states has shown to improve access to care for our patients and allow them to seek primary health care and mental health care, to improve the services for our patient populations who are served by Medicare, Medicaid, especially our rural and vulnerable populations.
Fantastic. Well, it's clear to me there's many benefits of the legislation, both for rural and urban areas, underserved populations, really improving access to care. And we also just want to emphasize this bill does not change the scope of practice or for advanced practice nurses. And even with the removal of that written contract called a collaborative practice agreement, we're always required as healthcare professionals to collaborate anytime it's necessary for patient care. So we have support of many legislators and organizations for our bill, which is great. In February, just to review, there were hearings both on the House side and the Senate side in the same week for the bill. Unfortunately, the House Health Committee was not allowed to vote on the bill, so it didn't have the opportunity to move to the floor. So we haven't had any final action. But we have really good news. On March 5th, the Senate version of the bill, Senate Bill 174, was removed from the Senate Public Health and Welfare Committee, and it was placed in an exempt committee, the Federal, State, and Affairs Committee. And this was under the order of the President of the Senate, Senator Ty Masterson. And this is called blessing a bill. But what exactly does that mean, Susan, to have a bill blessed?
Really, when we look at this bill specifically, Senate Bill 174, it has life through the end of the 2022 legislative session. This means the bill still could go through the legislative process this year, but most likely it's really been put on a pause until next year. So can you give us some ideas what we should be doing for advocating for APRN legislation moving forward?
Absolutely. So again, the really good news is we have more time to educate both legislators and the public about all the benefits to this advanced practice nurse legislation. And so the most important thing that we can do right now is to continue sharing the work that we do as advanced practice nurses. Kansas legislators, they really need to hear from constituents in their district. So they need to hear from us, from our family and friends, from patients, really from those who can speak to the high quality health care that APRNs provide as part of the healthcare team and how specifically this is going to be good for the state of Kansas. So please stay tuned. Watch for email updates from KAPN. Remember to go to kslegislature.gov if you're not sure who your current legislators are. And if you missed it,
our president, Amy Siple, was actually on the John Whitmer show that's based out of Wichita. That was on February 28th. And in case you missed it, you can go to our KAPN website, or there'll be a link in the notes here that you can go ahead and watch her interview. So we just want to say thank you for all the work you do and continue to stay engaged with the legislative process and supporting APRNs.
Thanks so much. We'll see you next time.